The best time to become pregnant, firstly, is when you feel you're ready to take on the enormous responsibility of caring for a child and the pregnancy is desired and planned. But when you've come to that point, then it's a matter of achieving pregnancy and what part of the menstrual cycle is best to engage in intercourse to try to achieve this. Fertility rates, meaning the ability to become pregnant, decreases over time. By the time a patient is 39 years old, the rates of fertility drop off drastically. Having said that, it's not impossible, and there are ways to help you achieve pregnancy, but it does become more difficult to do it on your own. So in trying to achieve pregnancy, first you should know how long your whole menstrual cycle is. Menstrual cycle, a normal menstrual cycle is considered to be between 25 and 35 days. To know what your menstrual cycle is like, you should first start by writing down on a calendar the days that you have your menstrual period, and do that for several months and see if there is a clear pattern. If there is a clear pattern and it lies between 25 and 35 days, then the next thing to figure out is when you ovulate. Most women don't know when they ovulate. They have no sensation of it. There are some women that can tell. They get a certain pain or discomfort that lets them know that, but that's not very common and not always that reliable. So to know when you ovulate, you can use the calendar that you will have created. Ovulation occurs anywhere between 13 and 15 days prior to the onset of your menstrual period. So that is why you should monitor your menstrual cycle for a few months. That way, going forward or looking forward, you can then predict when your ovulation would be. And the optimal time to achieve pregnancy would be to engage in intercourse on the day of ovulation. So, for example, if your menstrual cycle is 28 days long, then you'll probably ovulate on days anywhere between days 13 and 15 of your cycle, and in that time period is when you should engage in intercourse. If your menstrual cycle is 25 days long, then the days of your cycle where you would engage in intercourse would be days 10 through 12. And if your cycle is, for example, 35 days long, the optimal time to engage in intercourse would be days 20 to 22, and so on and so forth. And once that it has been attempted for a year and still not achieving any pregnancy, then you can seek out the help or assistance of a gynecologist, and there are other ways to help people achieve pregnancy.